Well, David, I am told that people most in need of help after suffering a heart attack, a stroke, an allergic reaction, or other urgent or life-threatening emergency won't see any difference in response other than possibly faster response times.
In the event of an emergency, we're told to call 911.
However, sometimes people call 911 for low acuity calls that maybe an emergent ambulance response isn't the best option for them.
Because dispatchers say they're getting more of these less serious calls, in Clackamas County, some callers might get transferred to what's called a nurse navigator, someone licensed and trained to provide the most appropriate kind of care.
We don't want it to ignore these calls. People are calling for a reason.
Bill Conway, the Public Health Emergency Services Manager for the county, explains it's one of the short-term solutions to a shortage of paramedics and first responders.
So improving staffing and adding ambulances is one answer to the EMS issue. But we think that another answer is to actually better utilize the resources that we currently have. And the nurse navigation program is going to allow us to do that.
If an operator determines an ambulance isn't the way to go, a nurse will offer other assistance, like a referral to a clinic or primary care, or scheduling transportation to an appointment or setting up a virtual one.
There's lots of really good options that are appropriate and actually more beneficial to the patient versus waiting in an emergency department where they may or may not get what they're looking for.
Last year, Clark County dispatchers launched a similar program, one of the many Conway says that they look to for guidance.
Every single one of them were very pleased with the outcome.
The point is a simple one: a faster response for those who need it most.
That's the whole idea, right? So we're taking all these calls that would normally get an ambulance and possibly a fire resource. We're taking them completely out of the 911 system. So what we're hoping is that results, you reduce the number of calls, you have more units available for the life-threatening emergencies.
And when it comes to cost, Conway says there's none for the caller, including if they need transport, like a ride to a clinic appointment the nurse navigator schedules for them. Now, there would be, of course, a cost for the actual doctor's appointment. David?
Yeah, but it's good to hear people talking about solutions. Thank you, Alma.